to the August 21st, 2025 all-member meeting of the Poverty and Homelessness Board. I'm Sean Murphy, and I am the chair. And at this point, we are going to open it up for public comment. Okay, all right, we don't have anything yet. And how about if we go around and do introductions? And I will start with myself. I am Sean Murphy, the Executive Director of Laurel Hills Center, representing behavioral health.
Pat Farr, one of the co-vice chairs from Lane County.
Mike Fleck, Executive Director of Community Sharing Program. I'm a sector representative on the board.
I'm Maggie Bagan, a board member.
Heather Kwasanza, co-director at Community Supported Shelters and sector representative on the board.
Reagan Watches, Homeless Services Manager at the City of Eugene, and I'm here sitting in for Mayor Knudsen.
Amy Wilson, Program Services Coordinator for Shelter and Severe Weather Response with Lane County Human Services.
Just gonna jump in. I'm just Melvin Niles. I'm not associated with an organization, just concerned citizen and interested in the meeting.
Hi, everyone. I'm Kim Locks. I'm the Executive Director for Hope and Safety Alliance, representing domestic violence on PHB. I apologize I could not be there in person. It was one of those mornings here in the office.
Go ahead, Kate. We'll finish on the video, and then we'll come back and finish at the table.
Sure. Kate Budd, Human Services Division Manager with Lane County.
Jack?
Hello, I'm Jack Boyson, Administrative Director at Siemens and DePaul. I echo Kim's apologies. It's just been one of those mornings, but so good to see you all, even though it's virtually. I'm a non-voting member.
Avery?
I'm Avery Pearson. I'm from Shelter Care. I'm the executive assistant, and I'm a candidate to be a sector representative.
Genevieve?
Hi, I'm Jen Schock. I am a rurally serving elected official as a board member of the Upper Willamette Soil and Water Conservation District, but I am also the development director at Breeder Brigade.
Thank you. Did I get everybody, Brianna?
Someone from Ansar just joined.
Jonna? Is that what you said? Okay.
Hi, I'm Jonna, non-voting board member, working full access near Eugene. Again, echoing Kim and Jack, one of those mornings. I wish I could be there, but thank you very much.
Thank you. Now we'll come back to the table.
Amanda Borda, Senior Program Services Coordinator with Lane County Continuum of Care staff.
Sheila Wegner, Oregon Department of Human Services, Lane County District Manager, and I'm a non-voting member as a mainstream representative.
Hi, I'm Sherry Walton, and I am a voting member. And currently, I work for the River Avenue Navigation Center as a case manager.
Hi, I'm James Yu. I'm the Homelessness and Community Action Manager with Lane County and help to staff the PHB.
Thank you, and welcome everyone again. And I'm assuming public comment is still quiet. So we are going to go to the consent agenda. And as a part of that, hopefully everybody got to take a preview. We're approving the minutes from the June meeting, accepting the July 2025 Statement of Revenue and Expenditures and the financial dashboard. And then on the agenda today, for those who might not have one, it's the funding update and the recent executive orders, the membership update, and we will be voting on that today. Medical respite shelters, information and discussion, the ad hoc committee creation discussion, committee updates, the October PHB member workshop, and then wrap up. And so with that, do I have a motion to approve the consent agenda?
So moved.
Second.
All right. Any discussion? All those in favor?
Aye.
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 Any opposed? Any abstentions? Oh, it passes unanimously. All right, and with that, I will turn it over to James with the funding update.
Thank you, Chair. Brianna's working on getting the slides up, I think. Yeah, so thank you. I want to start by saying, a month ago, if you had asked me if I thought I would not have many funding updates to share in the August meeting, I would have been very surprised. But here's where we're at. We continue to not have the funding picture for this fiscal year and beyond. So we are still awaiting allocation amounts from OHCS, the Oregon Housing and Community Services. The only timeline we've been given so far is that OHCS has said that the funding for the long-term rent assistance program, or LTRA, which is one of the executive order all-in funded projects, they have told us we should have an amount by August 31st. There have been dates that have come and passed, so take that as you will. We have unknown timelines for our emergency shelter funding, homelessness prevention funding, ORI, which is a state funding source that funds our diversion program, all remain on unknown timelines. We certainly recognize how difficult and challenging this is for the providers on the call. It's difficult for our office as well. And so just want to again express gratitude to the providers for their patience, and I know this is an anxious time. What I can say is Lane County is advocating strongly and pushing on OHCS as well as the governor's office with that sentiment that not knowing the funding picture is incredibly detrimental to our community. So I just want that to be heard, that there is not advocation, that's not a word. We are advocating to get those amounts as soon as possible. So that's where we're at with statewide funding. Federal funding is a similar picture. Brianna, if you can go to the next slide. So want to start by just talking, and I know it's been out now probably a month or so. So the executive order titled Ending Crime and Disorder on America's Streets, I would assume many, if not all of you, are familiar with that executive order, so I'm not going to get into great detail on it. But the general message is that there is an interest from the federal government in forcing folks experiencing unsheltered homelessness either to enter into a shelter, go into treatment, or face jail time or criminalization. It notes an end to wanting to support housing first policies, similarly cuts harm reduction focused funding. I do think it's really important to note that with all of the executive orders that have come out, this is not law. This is, we've recently met with our HUD rep, and he even said that he hasn't been given any formal guidance coming down from the president's office. So it is very unclear, how these words in the executive order are actually going to play out. And so, what we're waiting for is the NOFO. As you may remember from previous meetings, we thought, we were good with our HUD funding for 2 years, and then found out we were going to have to apply again for this new notice of funding. We have not received any information to indicate it won't still be due in October, which is the standard timeline. Not having it released this late into August is wild, and Amanda is very anxious, as that is a lot of work to fill that out. So, all that to say, I think we're really waiting to see what's actually in that NOFO and what from the executive order may guide what they're looking to fund federally. We just don't know yet. There was a webinar yesterday that was held by a advocacy group based out of Washington, and I admittedly wasn't there, but I heard that there was messaging there of, communities as they are applying for this NOFO, and this is paraphrasing a bit, but they shouldn't compromise their morals for a point or two on the COC application. So I just want to emphasize, this board, as the board of our COC, is going to have an opportunity to weigh in on that NOFO and that application, and I think we need to, or the board needs to make decisions that are based on what's important to our community and to this board. Again, it's a waiting game. Don't know when the NOFO is going to come. Obviously, we will alert you all when it does come. Similarly, when we know the state funding picture. Happy to answer questions. Also, there are folks in this room that are potentially better connected than I am to funding sources like the state. So if there's information others have or things I've missed, please chime in.
Any questions or discussions?
Is there anything that organizations can do to help with the advocacy? Say, like, when are we going to get the funding? Like, we're all waiting with bated breath, and not every organization has reserves.
Yep.
And so this is not a fun time for a lot of organizations.
Yeah, I mean, I would encourage you to talk to your local representatives, to elected officials, to OHCS, the folks that can influence, them to get those decisions out. So,
Do you have specific talking points that you want us to utilize?
I mean, the talking points that we're using are just basically what you just said, like how difficult this is for providers that don't have, which is most providers, to be honest with you, have vast amounts of reserves that they can use to get them through this period of time. And, so to me, the message is that it's that these are not only the lives of the people you serve that are going to be affected by, the potential loss of these services, but it's your staff that are human beings that don't know, can't have confidence as to when their paycheck, or when, if the agency, is awaiting funding for several more weeks or months, that's going to jeopardize your ability to pay your staff. So, I think that type of messaging is what we're using in our conversations, and I think reinforcing that is important.
Okay, thank you.
Maggie.
Yeah, I just wanted to say, I worked on poverty issues about 20 years ago with welfare district reform and stuff, and worked with Jeff Merkley both when he was in the state Senate and the Fed, and he's been really supportive. But I think with Wyden, he likes facts and figures. So, just what I've noticed with him.
Well, Maggie, that is a wonderful point, because a lot of people not thrive, but they get their true information from facts and figures. Some people are that way, and we witness that. The more we can give absolute, accurate numbers and facts and figures, then people like Senator Wyden can understand it even more clearly than he does already. And with Senator Merkley, anyone who knows him, we all know him at some level, knows that he likes stories about people. Kind of a different sort of approach that the two of them have.
He's a wonderful human being.
In fact, he is. I served in the legislature with him, and he's a good racquetball player too, by the way. But that's a different story. So my question on that is not a question, but a comment, is that if we can have actual anecdotes about the effect on individuals. You mentioned paychecks for staff. That's certainly an issue. But what about the people who really are losing the things that they need to exist, very specifically, because of both the delays and the pulling back of support? And that's something that I would love to do at the Board of County Commissioners meeting as early as this Tuesday. Tell a story. Not with a particular name, but this is what is happening to a family in our county because of the delays and our inability to get the funding directed to the people who need this. It's not about, when you look at big numbers, like the federal government's looking at numbers this big, well, it's easy to get lost, easy to lose faces in that. But what we really are working for are the faces of the people that we serve.
And how little fraud there really is. I did a research, it was years and years ago, but I did a research on public assistance, and the fraud rate was like, on the state level, I think it was 2% or something like that. And, there's a lot of misconceptions in the general public that maybe we can rectify.
Those are wonderful words. Thank you, Maggie.
Kate?
Thanks. Right now there's just a lot going on, and I know for us, just tracking it all is challenging, and let alone thinking about where advocacy is needed most greatly. And while I absolutely hear the challenges that not only our agency, but all of our provider partners are having with the state funding, I also recognize that they have been very clear that when we are asking, to talk specifically about situations and like asking what's going on, it deters them from being able to do the job that they need to do to get the numbers out. And so my encouragement is to focus on the federal level. And know that we have pushed very hard on the state, and know that they're moving forward, that we're closer to getting numbers than we have been, and that they're continuing to work on it and ask questions. So that'll happen. And where the focus really feels like it's needed is on the federal level, because the potential of cuts are so extreme. When we're talking about community service block grant, LIHEAP, continuum of care funding, potentially community development block grant funding. And so we're happy to send out some key talking points regarding the federal funds that are at risk for this next fiscal year. And as folks said before me, the stories are vital. And so we can share a bit about that too, and who you could reach out to within our region as far as elected officials go. But that federal advocacy is really important. Many of you might be aware that our federal delegation was in town at least yesterday and the day before, and healthcare officials we're meeting with those individuals. And so we know that they're paying close attention to what's happening in our region. And so we just need to continue to be at the forefront of what they're thinking about as they're advocating. So we're happy to send out a follow-up with talking points. I appreciate that idea.
Thank you, Kate. Any other comments? So I want to appreciate everybody and all the providers and the county for all the patience, because I know we're all just kind of white knuckling it at this point, because it's not just the money that we're waiting on, it's the money that we already have that might be in jeopardy. And I was just laughing today because I get a contract, and then before I can even read the contract, another one is coming through to say, okay, here's all the new federal changes, and we took some out and we added some in, and so it's very chaotic and it's very stressful. And if it's this stressful for us, I can't imagine what it's like for the people that we're serving and who are relying on us, that we're going to be there. So.
Yeah, actually, I did want to touch on that really quickly. The executive order is really impacting the people that I serve who are afraid. They're like, but there aren't treatment centers, there aren't mental health facilities. What is going to happen to me? And it's very hard for me to have that conversation because I don't know what the answer to that is yet, except that, be thankful that you live in Eugene, be thankful you live in Oregon. I really think we're going to do everything we can to make this a positive experience for you. But people who are living without homes right now are really frightened. So anything that I can do to provide advocacy for them, to be able to write letters to whomever, I am completely on board with that. Yeah.
So I just want to also remind folks, and I'm always that squeaky wheel, so I apologize, but we're already going $80,000 into reserves to provide services this year. In the past, when we had shorter funding, we could reduce services. We're actually, all services out of our service center, we're now taking out of our own pocket. So I just wanted to kind of frame it that, yes, we're terrified of what could come, but we're already in a tough spot. So I just wanted to kind of mention that.
Thank you. Anyone else before we move on? Thank you, everyone. And we will keep you updated. So next is the membership update. So, oh, that's me. So hopefully, I'm sure everyone knows that we had an open call for PHB seats several months ago. Thank you. And the process, we had open seats for one sector representative, one stakeholder representative, and one elected official at large. And that was to replace Sheriff Harold. And then we had two members, Terry Hesh and Glenn Porter, who moved out of the area and had to vacate their seats. So the process with the committee was we reviewed all the applications. We had an initial scoring process where we all scored the applications independently, sent that in, and we were given back the list, and we looked at the folks with the highest scores. And from those applicants, we went on and did an interview process. We lost a couple through that process, but also in the end, we came out with a slate. So the first, which you met earlier today, was Avery Pearson for the sector seat. She works at Shelter Care. She lives in Oak Ridge. And I'm not going to read all the attributes, so because I only got 5 minutes. And then for the stakeholder seat non-voting, we have Wakan Alfers, who works for Homes for Good. And probably many of you know her. She's been involved around housing and homeless issues for many, many years. And then Dana Mary Day, the elected official at large from the city of Cottage Grove, Ward 3. So I'm very excited. We seem to be making some progress with getting more representatives from the rural areas, which I know has been our focus, and folks with lived experience as well. So, and with that, we have a vote to make it official. So, do I have a motion to accept the slate?
Madam Chair, I move that we appoint the 3 members to the 3 seats that are open.
Thank you. Do we have a second?
I second.
Thank you. Any discussion? Go ahead.
I just want to mention, I used to sit in the rural elected position, and when I lost the recall election, I actually had encouraged Dana to apply because I think he'd just be such a great fit for this. So I'm thrilled that he's actually going to end up here. So thank you to him, and thank you potentially to all of you.
Any further discussion? Okay. All in favor?
Aye.
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 Thank you. Any opposed? Any abstentions? It passes unanimously. Welcome aboard, everyone. And with that, we will pass it on to Amy in regards to medical respite.
My name's Amy Wilson. I am the Program Services Coordinator for Severe Weather Response Programs for the Unhoused. I just wanted to give an overview of medical respite shelters. Some of the criteria that's going to be standard across the board for all of the emergent medical respite shelters is clients are going to need to be 18 or over. All of the medical respite are adult-only facilities. Clients need to be exiting or recently exited a hospital or a medical care facility like a skilled nursing facility. And they're just going to need some ongoing care. And exiting to homelessness is not going to help improve their situation. At all of the shelters, clients are going to need to be able to handle their own activities of daily living. So that's going to be toileting, eating, washing, any ambulatory needs. And then clients are they have to be homeless in order to access the services. If they have housing of some sort, they wouldn't be accepted. They are going to need to be literally homeless. And all of our medical respite shelters are low barrier facilities, so they're going to accept pets and possessions. The average length of stay actually varies across all of the medical respite shelter sites, and the set length of stay is determined by the CCOs or healthcare systems who are referring folks in for services. And then as we get into the slides, it'll be better explained what the length of stay is for the individual shelters themselves. The shelter staff are not able to offer any hands-on medical care to clients. So every day, medical care teams, nursing care, and wound care providers, they're welcomed into the facility to work with those individual clients on a one-on-one basis, since that's not something that can be provided at the shelter by the shelter staff. And then the shelter staff are, though, connecting folks to long-term care facilities for people who have those ongoing needs. At the medical respite shelters, they're going to be offered a lot of the same services as any other emergency shelter is going to provide. They're going to have a shelter bed for recovery. They'll have 3 meals a day or access to meal preparation facilities. They have all the basic hygiene standards for shower and laundry facilities, basic needs services. They'll be connected with a housing-focused case manager, as well as peer support services and housing navigation services for movement towards permanent housing. They are connecting folks with primary care providers and other mainstream benefits. The mainstream benefits, of course, are to help with the self-sufficiency and make sure their needs are met. And then there's also connections to employment resources and job readiness programs. Some of the shelters actually have those in-house rather than having to outsource to other agencies. And then there's connections to housing moving costs and assistance, as well as other community resources that's going to help stabilize them in housing. The medical respite shelters are not, like I had mentioned before, able to offer any life-sustaining care or on-site or hands-on medical care. And then, of course, they cannot assist with the activities of daily living, which is another important reason that those, the nursing care facilities are coming in to help for folks. So it is exciting. We have 74 medical respite beds across Lane County in the shelter network right now. 2 of those are operated by Equitable Social Solutions. We had a new medical respite open with Everyone Village. Shelter Care has been a medical respite provider for many years. St. Vincent de Paul has a new program that's starting, and then Carry It Forward offers the Tom Campbell Medical Respite Shelter. So in terms of Equitable Social Solutions, they have 2 medical respite shelters. One's located over on Brooklyn Avenue in Glenwood. The other is over on, it's called the Garden Way, though it's on Hickory Avenue. And they prioritize referrals from hospitals and Peace Health's outreach team. Then anyone who has respite-related medical needs would be prioritized, and they do accept lateral transfers from other medical respite providers. Right now, they're working off of a 90-day case management model for clients in shelter, though there is no set length of stay. If they have clients who are steadily working towards housing or have ongoing medical needs, they are not going to be exited out to the street. For those who are no longer requiring any kind of medical care, they are doing everything they can to laterally transfer those clients into other available emergency shelters. And both of their programs are funded by all-in dollars. Everyone Village is another of our new medical respite programs. They are only able to accept referrals from Peace Health, since that is who they are funded by. They're not able to participate in lateral transfers, since all of their referrals do need to come from Peace Health, though they are able to laterally transfer some of the clients who have ongoing needs to other medical respite shelters. The length of stay right now is only going to be 28 days over at their site, unless an extension is going to be authorized by Peace Health. Shelter care has been in the business of medical respite for a lot of years now. They prioritize referrals from Pacific Source and Trillium healthcare systems, medical providers, skilled nursing facilities, and hospitals. When they do have available beds and do not have referrals from medical providers, they're opening up a shelter. They are opening up that bed on the Lane County Shelter Finder page so that folks are able to connect with those beds. And self-referrals need to just reach out to Shelter Care directly for their referral process. They are able to participate in lateral transfers so long as it is authorized through Pacific Source or Trillium. And then they can also transfer clients to other medical respite shelters if needed. The length of stay right now is 28-day cycle, though they can be authorized to extend folks by medical providers. Otherwise, they are looking at doing those lateral transfers into another facility. St. Vincent de Paul is the newest medical respite shelter. They will have pallet shelters over at Highway 99. They're taking over the former Peace Health shelters that they were operating. So they're going to prioritize referrals from healthcare systems like Peace Health, medical care and emergency facilities like Riverbend or Slocum. They accept lateral transfers from other medical respite shelters. And then they will also open up a bed on the Lane County Shelter Finder if they don't have referrals to fill available beds. Currently, the length of stay is 30 to 60 days, depending upon ongoing needs. And right now, St. Vincent de Paul is able to provide all of the medical supplies that are going to be needed for clients at that shelter. And then our final medical respite shelter is Tom Campbell. They prioritize referrals from Peace Health, hospital CCOs, and they're available for medically fragile individuals and couples. They do accept lateral transfers from other shelter providers, and they do not have a length of stay for clients in shelter. They are funded through the All-In. A lot of the clients who they're accepting are on hospice right now. With there not being enough hospice beds in the community, a lot of folks are landing with Tom Campbell. So we're just really thankful that there is a shelter who's able to help serve those folks in their greatest time of need. So, yes.
So what about the rural hospitals? I'm thinking like Florence. We don't have a shelter anymore. So are they taking people like from the outlying communities?
As long as a medical provider is referring in, yes. Yes.
And the hospitals are aware of this?
The hospitals here locally are. You guys have
So it would be
Peace
helpful
Harbor.
if we got the word out to Peace
100%.
Okay.
Questions?
Questions. Is the St. Vinny's one open yet, since that one's going to be all-in funded?
They are not open yet.
Waiting for that funding. Okay.
And Everyone Village, right now, they are serving clients already, though their grand opening is going to be September 16th.
Sorry, one more. I noticed for the shelter care one, lateral transfers have to be approved by Pacific Source or Trillium, but self-referrals do not. Is that accurate?
Correct.
Okay.
So if you are working with a client who's in need of this service, obviously I know a little bit about Brooklyn and Garden, but let's say they were full and I needed to find another place. How would I start that process? Like, how would I begin to do that so that I could get my client in somewhere else?
My first step would be to look at Shelter Finder to see if maybe there are any available beds. Otherwise, to contact the shelter directly.
Okay. I just didn't know if it had to be a referral from like a doctor or something, and if that's the way that it happened, or if it's me calling them and saying, hey.
So long as that client has exited or recently exited some sort of a medical care facility, they would be eligible.
I would also just add too, there's still flex funds that are available to some degree through the CCO. So if you're working with a client that is, a Pacific Source or Trillium member, I would encourage them to look into accessing the flex funds, which can pay for hotel stays for folks that are recovering from medical issues.
Do you know how well the 74 beds are able to meet capacity?
I would say the fact that hospice clients are being transferred into a medical respite shelter rather than to a hospice facility, there's not enough.
Similar to that, I was curious, this is so much more than we've had, it's a celebration, an expansion worth, celebrating. I was curious if we do see this need among families with children, since there aren't medical respite for households that do have children under 18.
To my knowledge, there hasn't been a lot. With them being adult-only facilities right now, trying to house a family in a medical respite shelter is going to be very difficult. I would anticipate it's just going to be that one family member who is able to enroll, other than potentially Tom Campbell will accept couples, but they do have to be adults. It's an adult-only facility. So connecting with some of those family shelters to see if there are any abilities to, shelter one individual in a family who does have medical issues. There would need to be a lot of collaboration, I think, in something like that. So, but it is something worth looking into.
Other questions? Thank you, Amy. Wonderful presentation. I am excited about all the bids that I didn't realize we had that much out there. And know we continue to have the need, but that's exciting. And I'm excited really about all the collaboration. The fact that so many providers are able to do these transfers and these moves based upon what they have available and the needs of the individuals. And that we're working really hard, that even when in medical respite, that it ends in another safe move, and just not from medical respite back to the streets. If we can help, that is great. So thank you. It's a wonderful presentation.
Just a quick question. The slideshow, will that be in the minutes?
I wanted that too.
Yeah, we can get that sent out for sure. Yep.
Thank you. Wonderful slideshow.
Good.
Thank you.
Yeah.
A great example of that private, public, nonprofit, everybody partnership in trying to make it work. So, thanks. Okay, and with that, we are on to the ad hoc committee creation discussion.
Yes, thank you. Wanted to loop back. I know this has been an ongoing conversation that the board has been having now for several months, but the creation of new committees, and then just want to kind of refresh the memory for folks regarding our continuing committees and how the work of all of these committees is going to fit into moving forward the strategies that were outlined in the strategic plan. So wanted to just give a reminder to folks of the committees that we currently have that will be continuing as we move forward. So our Continuum Care or COC committee is a committee that's focused primarily on related to the application and competition associated with our COC application. So Amanda staffs that committee ad hoc, and when it is meeting, it's related to looking at evaluating the COC, the funding of new projects, potential reallocation of funds across those projects, and then the ranking of projects as is necessary, and also looking at the COC competition policies. Our coordinated entry stakeholder committee, as many of you may remember, over the last couple of years has primarily been focused on the replacement of the VI SPDAT as the assessment tool used for coordinated entry, and that committee, as well as League, worked to create a local Lane County vulnerability assessment tool. Since, that committee is going to continue to be analyzing how that new tool is functioning, but as they've moved away from the focus being on the creation of that new tool, they've also looked at things around access to coordinated entry and ways that can be streamlined. You may remember the last time I talked about committees, one of the proposed committees was a Built for Zero specific committee, and Built for Zero is an initiative that was created by Community Solutions, and really the idea is that being built for zero, the idea is that a community is reaching functional zero, which is the idea that the community is able to house as many folks in a given period of time as are entering into homelessness. And so the strategies that are provided by Built for Zero relate really closely to coordinated entry. It's around prioritizing populations, case conferencing, many of the things that we already do, but it felt like the goals that were associated with the creation of a Built for Zero specific committee best fit under the existing coordinated entry committee. So I just want to note that's a change from the last time we talked. League, our lived experience advisory group, obviously is advising the PHB on projects related to the board's mission and the strategic plan. And that committee is comprised of folks that are currently or formerly experiencing homelessness. Our Youth Executive Committee relates to the YHDP, or Youth Homelessness Demonstration Project funding that we receive, and they really are, as the name would indicate, focused on goals and priorities that relate to youth in our community. And then the Community Needs Assessment Committee, which is, calling it a continuing committee may be inaccurate just because it meets as needed, just related to the community needs assessment process. So Brianna will be leading that committee, which really is going to be focused on the development of our 2026 community needs assessment, which is the process that we utilize as a community action agency to identify what the needs are in our community, and work to identify those areas that we need to increase access or funding to. So those are our existing committees. I do, I probably should have started this by saying, really want to emphasize to members of this board that these committees function best when there are members that are actively involved. And so as we move into developing new work groups and continue these existing committees, we're really going to be looking to board members to identify committees that they feel moved to join and be a part of. And, if that's one, if that's several, depending on, the time you can commit, that's great. But really just want to frame this conversation as, please use this presentation to help identify committees that you feel like you could provide expertise to. So moving to the next slide, this again is a little bit of a refresher, and I know this slide is has a lot going on. So as I noted, we did remove the Built for Zero specific committee. That work will move under the Coordinated Entry Committee. There also was there were two separate, there was a Basic Needs Committee and then a Food Needs Committee. When looking through the goals that were prioritized through the surveying that we did, it felt like those did not need to be standalone committees, and so moved around some of the goals that had previously been identified under basic needs and put those into one or more of these other groups. And then the food needs group is still remaining with that primary focus related to increasing access to food in rural areas. So as you'll see, each of these work groups has a specific goal or several goals that are coming from the strategic plan and are coming from that prioritization that was done through the survey. The goals are, admittedly broad, and I think the opportunity is for these work groups as they are created to really, and through guidance from the PHB, really get in the weeds of what these goals mean and what the strategies to be used to meet those goals are going to be. And so we really will look to those committees to, report back regularly to this board, and then for this board likewise to help to guide the work that they're doing. The timeline that we're looking at, so each of these work groups will be staffed by a Lane County staff member who's going to work with the members of the board who are participating in that committee to identify the additional stakeholders that should be a part of that committee. So, looking at cross-system collaboration and resources as an example, that's a work group where we're going to want to make sure we have the right folks in the room that represent those systems. And so, folks from the healthcare system, potentially folks from law enforcement, from the different systems that folks experiencing homelessness and poverty are likely to touch. So just really, working over the next few months to get these committees up and running and identify membership with a goal of these committees starting no later than the first of the year, so January 1st. Potentially, if there's a way for them to start sooner than that, great, but that's the goal that we're working on, are working from. And again, it really will have a lot to do with participation from the board here. I did want to touch, if you can go to the next slide, Brianna. I did want to just touch on, conversations that this board has had frequently, and conversations that the chairs and I had when we were working on this agenda, and just recognizing that there's a lot going on in our community as far as entities that are moving forward similar work. And there's a lot of asks for people's time in spaces and in meetings where there's often similar representation. And so, really looking to this board today to kind of talk through ways that there can be some collaboration. And this is just an example of some of those entities. The MAC group, the Multi-Agency Collaborative, which is the group that I also staff that is moving forward the goals of the executive order. There's similar membership, some of the same members in that group. There's the work that the Eugene Chamber is doing through the Act Now Lane. There's the Human Services Commission. So just a recognition that you all have a lot of asks of your time, and are there ways to, going back to what Sean was saying in the last presentation, are there ways to collaborate amongst these groups, and ways to potentially merge the work, for an example, merge the work that's being done in the MAC groups, task groups, with the work groups and committees that the PHB is working on. So that's just a talking point that I'm curious to hear from folks, their thoughts on that. Is there another slide or no? Nope. No. So that's just an overview of where we're at with work groups and committees. Want to hear your feedback, input, even if it's just saying one of those committees that you identify being one that you would be interested in. But primarily the discussion I think that's really important is, is there an opportunity to, collaborate/combine efforts to be really efficient in moving forward these goals.
You want us
Heather's
to email you?
You can email me. You can say right now if you're interested, and I'll jot down. But we just whatever way you want to communicate. And then, as I said, we have so I didn't mark it here, but we have kind of mapped out which county staff are going to be associated with each work group. We also have an intern that's going to be joining our team in the fall that has an interest in kind of big picture policy stuff that we're going to utilize to help with some of this administrative stuff. Because the other piece of it, to be frank, is our team staffs the MAC group task groups. They're staffing the PHB group. So there's just a lot of asks that are going on, and we want to make sure that we're being, again, just as efficient as possible in all of those spaces.
Then I know Heather, and then also, Jen.
Yep.
Next.
Yep.
Go ahead, Heather.
Okay. So I'm already on the COC. I would love to be on the training and the advocacy, depending on timing for those. I think one thing that would be helpful is if the chairs of each of those different groups and committees, or some representative would maybe share agendas. And we can, if we're all talking about the same thing. How about we have one meeting instead of 4 meetings about it? I know for me, I have dropped off of attending some of the other meetings that I am not like a voting member on, because it just kind of seems like we're swirling and there's no action that's actually occurring. We're just being talked at for an hour, hour and a half, 2 hours, and no movement takes place. And so I think if we actually have an agenda with a goal in place for each meeting, like this is what we're hoping to accomplish with this meeting, because we can all read what's in the packets. Like, I don't need to be read a PowerPoint presentation. And I've heard that from other folks as well. Like, these meetings are duplicating what other groups are already doing, but some of the meetings are more action-oriented, whereas some of them are just informational. So just paying attention to, like, what is the purpose of the meeting? Like, could this meeting have been an email? Probably. Like, if not, like, what are the steps that are actually going to take place? Who's being assigned tasks at the end of each meeting? But knowing what other groups are talking about and then trying to combine as much of those meetings as possible, because we are all in all of those meetings and it does become quite redundant. But yeah, that would be my recommendation, is trying to get the chairs to share in advance what their topics are or what their planned topics are, so we can combine as many meetings as possible.
Yeah, I appreciate that. And also just to give some context, I think, my intent, and I would be curious to hear from members, would be to, there will be a regular standing agenda item at these meetings moving forward, where it is actively engaging with the chairs of the work groups and the committees to have a back and forth of like, what's the next, what's the assignment, or what is the PHB asking this committee to do next? And similarly, the committee kind of sharing back what they've come up with that, related to the goals that have been identified. So yeah, I think that, I've been involved as a provider with the PHB and then as county staff. And I think this is the most, or the closest I've seen to this board being very clear and deliberate in using this time and this entity to move forward very tangible, specific goals. So just echoing what you say, I think it's really important.
Go ahead, Jen.
I'm definitely all about food access, particularly in rural areas. But I also, do have concerns about duplication of services and assessments. The Community Health Improvement Plan just did their big year-long assessment through the MAP 2.0 process, and have conducted a lot of interviews, and surveys and all of those things, as well as analysis of extant data. So those resources exist. At the same time, that's coming right on the heels of another organization having done a Lane County and Douglas County needs assessment. So I definitely would love to advocate for not actually redoing all of that stuff is so labor intensive. So of the places in which I have overlap, because some of the rural food access issues are definitely covered in meetings through like the Oak Ridge Soup Group or the Grow Lane County Project. So I could go on about some of the overlap, but I think you can definitely sign me up for the food one and potentially the CNA if it means I get to provide shortcuts.
Thank you. Mike?
So, James, can you tell me a little bit about the basic needs group? I didn't know we had one, what they were talking about, and how those topics are still being held in the other ad hoc committees.
So to clarify, we haven't had a basic needs committee existing. So it was in the meetings building up to this when I had shared some of the proposed work groups, and 2 of those that have since been removed. One was the basic needs one, and one was the Built for Zero specific one. And so really, it's not that we changed or got rid of the strategies or the goals that were associated with the basic needs committee. It just felt to me like it didn't need to be a standalone committee. And so those goals were then moved to one of the other groups.
My big concern is that's where the biggest lack of funding seems to be, is in, those services, and they're critical for homeless prevention. I mean, being able to help somebody with a $125 water bill might, allow them to keep their rent paid. And so this is something I'd hate to see slip through the cracks. I mean, obviously I have a little bit of a stake in this, but ultimately I do think it's a piece that we don't want to lose.
Yeah, no, I appreciate that feedback. I think that's, that's valid for sure.
You mentioned healthcare as part of, being important to have in the cross-system collaboration. And I don't know if these strategies are sort of the first iteration of goals that will be handed to these groups, but I don't see like physical healthcare called out in those goals. And I know there's a lot, as we just got the presentation, there's a lot happening. There's a lot of opportunity that I'm hearing about. So I'm wondering if that needs to be its own. We've had a healthcare committee. So I'm just wondering if we might have more discussion about that.
Yeah, it goes back a little bit to kind of what I was saying about
I don't think it will.
the board kind of being prescriptive in what the committees work on. So the goals that are listed, those are the specific strategies verbatim from the strategic plan that were prioritized through the surveying. And going back to what I was saying is that they are broad. And so I think the opportunity is that the chairs of those committees as well as members of this board look at those goals and identify what the strategies are and who needs to be at the table. And so if the PHB thinks that committee, that those goals need to be specifically tailored to healthcare systems or tailored to whatever other system, that's the opportunity, I think, for the board to prescribe that to the committee and vice versa for the committee as it gains membership and stakeholders to, report back to this body, like what's realistically doable for them within that space. But yeah, it's definitely, these are, I see this as like the very early iteration of a work plan. And then as they dig into these broad goals, that's where they're pulling out the really specific in the weed stuff. Yeah.
Yeah, I think one of the things, I'm on 3 of those 4 committees that you were talking about, and I was on the health committee. So I think one of the things that we were talking about with the PHB is kind of looking at what was in our scope as the PHB, but then also how we can bring in these other groups that are also working on things and other spaces where they might have more resources and it's more within their realm to push forward and address some of the problems that we see in PHB, but within our scope and what we can advocate for within the PHB system, we might not be able to push forward. So it was kind of looking at like with behavioral health and looking at healthcare, that we definitely have concerns that we see in the PHB and we see in shelters and in housing, but how can we bring in, Commissioner Farr is going to tell me what those 2 entities are because he's on the board for mental health, and I am not on that council, but how can we bring those folks in to say, hey, this is what we're seeing, can you help us understand what you're doing, what's available out there, and then if there's anything that as the PHB we could be advocating for at a higher level, that we would love to advocate and support your efforts, but that we realize as the PHB, we might not be able to move forward or even have a lot of resources that could be dedicated to improving those systems. And so really trying to pull in, kind of like how the CCOs have been brought in along with St. Vincent de Paul and the other social service agencies, of bringing all those resources together to address the shelter need. And so I think that was part of where that was going, looking at the committees with the PHB, was that we wanted to make sure that we were reaching out to people who could definitely help with make some progress and that we can actually go to say, hey, we're hearing that this is a need and this falls under your purview. Can you help us out or kind of help us understand? And then also making sure that within the committees that we're doing everything that we can within the COC and the other areas that encompass the PHB to be more efficient and effective.
Well, I'll tag on to both what Heather said and what the chair just talked about the, Heather, you said, could we have done this with an email? Who enjoys going to a committee meeting that could have been done with an email? You got other things to do, right? Mm-hmm. And I think what we're talking about here is consolidating the cumulative power of different boards that we have and combining that power to make an even more powerful entity. I look around this table and I look around the membership of this board. This is the most significant board that has ever been formed in Lane County. in my estimation. If you look at the membership, you look at the very carefully chosen positions that are on the Poverty and Homelessness Board, and it has the capacity and the power to really give legitimacy to the work of other boards and committees. And I'll take, for instance, the MAC, the Multi-Agency Collaborative, which was developed all in Lane County, and it had a great deal of resources to work with. As funding by the governor, a lot of money came in, and we were able to very effectively distribute that money. If the Poverty and Homelessness Board had been even more engaged in that, then we could more accurately, more powerfully describe the work of that committee. And I'm kind of stumbling with my words a little bit here. What I'm saying is that the Poverty and Homelessness Board can give legitimacy to other committees by giving its advocacy and the work of this board to their work also. The upshot of that is that other committees have resources that we don't necessarily have here, but we can help them more effectively utilize their resources by using the combined strength of the membership of this board to help them focus on how their resources can best be used. There's no other board in any place that I've seen in Oregon that has this kind of membership. People see this in other counties and say, how did you get that done? Well, it's amazing how much work this committee is capable of, the Poverty and Homelessness Board is capable of, particularly if we're able to combine our efforts with other resources from other committees. Chair Murphy just mentioned the Mental Health Advisory Committee. It's statutory, we have to have it. The law says we have to have a Mental Health Advisory Committee. It doesn't get a great deal of resource, but it provides a great deal of vision. And if we can help use their vision and the work of that committee, for instance, to help us with our work, and conversely, the work of the Poverty and Homelessness Board to help them forward their work, I see a great deal of potential there. And, you know, James, you had the slide up there with it had the MAC, it had Poverty and Homelessness Board, had Human Services Commission, and one other up there.
Act Now.
Act Now, thank you. The strength, the combined strength is just unbelievable. And I really, if we can think about this, how can we get, by January 1st, I think is what you're looking at, James, is getting our committees woven in with the work of other committees. It does, I mean, the benefits can be tremendous. And I apologize for, I'm so excited about this that I can't even get the words out properly, that we really have a lot of potential here. You know, there are two things that we do. One is we provide vision, and the other is we provide boots on the ground. Vision is important, but it can't be done without boots on the ground. And I think that's what happens in the committees, and that's when we have the committees that actually do the work. You know, the presentation you gave today, Amy, that was so full of meat, so full of information that we can use as a board to pass along to the people that we work with. So anyway, that's I'm excited about this particular potential.
I know I can say I'm excited. I do know that Act Now, part of what they were waiting on, I know others were waiting on, was the PHB strategic plan, which we're strolling right along to get that approved. So I think that will be able to move some of that forward. And I support Heather's kind of recommendation, is that now that we have these committees and now that the strategic plan is moving forward to move to the county commissioners, we're kind of getting to that integral point where it might be great to bring all of those chairs together to look at of how we can all work together, cross-share information, using that the PHB strategic plan and what the MAC group has laid out, and what's going on with the other entities, and then how we can share all the information. I know for a fact one of the things that had came up was PHB, we have the COC information that we can share with the community about their outcomes, but then the MAC group is their own separate entity, and so their information doesn't necessarily get shared with the PHB, doesn't get shared with the PHB or through the PHB because they're their own entity. So any outcomes that they're doing to improve the unhoused and all of those pieces doesn't get shared at the same, the dashboard and all of those pieces, because they're their own committee. And so so we don't have that place, and we haven't figured out yet of how to bring everybody together so that outcomes from all these different folks that are working on it can be shared, but can also make it easier for, I think, the community, because there's a lot of, well, how can we help move this forward? And so that we're really getting to that nexus of that next big step, which is how can we bring everybody together so that it makes it easier for people who need the services to be able to navigate and get the information, for community members that want to help in whatever way, whether that's, financial, volunteer, whatever, writing letters. How do we have that space where they can go to and say, oh, this is how I can help, maybe carry it forward, that's a really dear thing to my heart. So that we're getting to that space right now of like, how do we all work together and bring these committees together so that we can have that information that is easily accessible and digestible.
Well, we all have the same DNA, so to speak. I mean, we all have the same thing driving us in the committees. The reason we're here is the same reason, to take care of the people who are least able to take care of themselves and to leverage services from all sources into direct service to the people that need it. We have the same staff in many cases that are doing all the same work. And, it's possible, it's reasonable, and it's perfectly acceptable for the Poverty and Homelessness Board to accept the victories of the Mental Health Advisory Committee because we're providing the same work to the same people. So if we can combine our efforts and rejoice in celebrate the victories that we have in taking care of people, that really generates more victory. And I use that term victory. That's not really the right term, is it? It really is. It's the actual genesis of providing services to people who need them, who've never got them. And I wrote this down. Where is it? A quote that I'm going to use over and over again. People that are living without hope right now are very frightened. Now that is an amazing statement that I'm going to share. I'm going to use that over and over again. People who are living without hope right now are very frightened. We are here to help people gain hope and to be less frightened. That's what we're here for. And the more we can leverage our work with other committees, the more we can make James and Kate's and Brianna's and Amanda's work easier, because they don't have to do it 3 times when they can do it 1 time with the entire group. So I'm once again very excited about the potential.
Other discussions?
I did just want to, because you mentioned it, Sean, just so the board is aware of kind of the next steps with the strategic plan. So as Sean mentioned, the plan is going to be presented to the Board of County Commissioners, I believe, October 17th. Did I tell you that? Around there, October 17th, I think. And Sean and Matthias, our co-chair, are going to present that to the board at that meeting. And at that point, it'll be officially adopted by the commissioners. And then we'll to officially move forward with the plan.
So what is the next step then after that for, we want to get these committees up by the beginning of the year? What do we think the next step is for that?
Yeah, so I will work with our team to just finalize who is going to be the associated staff, and then they'll start reaching out. In the interim, please, as email me or otherwise let me know of the interest in the committees that members may be a part of. And then our staff will begin reaching out to PHB members who are interested in being on those committees and hopefully being chairs of those committees, and then work together to identify the members for those communities or committees.
Then I will add the action step, and I will take that on with somebody reminding me that when the strategic plan gets passed in October, that we will reach out to the HSC, Act Now, and the MAC chairs to see if we can all have like a brief discussion and meeting about, now that the strategic plan is approved, how we can move forward between the ad hoc committees and everything that's going on, to try to at least bring back to the board sometimes before the end of the year, kind of like a draft of what we kind of came up with of how we can all move forward together, work together in 2026.
Are these committees already pre-existing? Like, you've done work on these committees before, right? Am I correct?
So the committees on the one side I shared that were the pre-existing committees, those have been existing.
Okay.
These new committees, they're all new, and the goals are new from the strategic plan. I think similar work has been done, but it hasn't been tied to a strategic plan in the way that it is now.
Okay.
But yeah, it's new. And one piece I forgot to mention, with this we have sunsets the health committee, which Sean mentioned. And I met with or presented to that group last week and really encouraged them to look at the new work groups to identify if there's strategies that align with their work. And along with that, because these are ad hoc groups, as these goals are achieved, those work groups may end, and there would be the creation of a new one that would focus on a different strategy that's in the plan, and maybe that's bringing back the health committee or some new creation or new committee. So just keeping that in mind, that these are adaptive, and really the hope is that as goals are achieved, that we're moving forward with new work.
I do want to say, not only as goals are achieved, but also as resources are available, because part of that flexibility with the new strategic plan is that we never know when resources are going to become available, and when they are available, we want to make sure that we're nimble enough and to jump on those and access them and bring them into our community. So that also means that through the time, there might be other committees that we're going to be like, hey, there's some resources available. We need to put together a new committee so that we can move forward the entire strategic plan and bring those resources into our communities. Great discussion, everyone. And I'm assuming I'll see all your smiling faces on those committees in January. All right. And then any questions about the committee updates? They were attached to the minutes for those committees that actually met. If you do have some, hopefully somebody's here to answer them, because I'm not on any of those committees.
I could answer questions, probably. I mean, I think in short, just a kind of a general consensus among those groups is there's a lot of waiting to see, what's next with the work groups, and as I mentioned, the healthcare committee will not be meeting formally after this month, but hopefully all of those members will move into these other committees.
Okay. With that, we're going to move on to the workshops with Trauma Healing Project. James, you didn't put your name by that, but you
no. So yeah, just a reminder that in October, can I steal this back real quick? No, you're fine. So on October 3rd and October 27th, there will be meetings with Elaine Walters, who runs the Trauma Healing Project that's been around for many, many years in our community. And the hope is, she'll work with the PHB individually, and then we'll have a joint meeting of the PHB and the HSC. And the hope is really to look at both entities and how decisions are made through a trauma-informed lens. So how does a governing entity like this take trauma-informed care practices into account when convening? And I think this much of this came from just the recognition that this board has done a great job of increasing the amount of folks who have lived experience on it. And I think sometimes the formal nature of a governing board like this can be intimidating, and so we want to make sure that the PHB is continuing to be a welcoming space and taking into account factors related to trauma-informed care. So that's the intent. As of right now, the plan is to not have a regular October PHB meeting. As we were talking earlier about the NOFO from HUD, depending on when the later that goes, the more likely it's looking like this board may need to have approval of that in October. So Amanda and I haven't talked through What exactly that may be, whether it's a full convening of the PHB, obviously really hesitant and know that you all don't have excess time to meet probably 3 times in October. So maybe it's a very short meeting just to approve the application. We don't really know yet, but just want to put that on your radar that because of that, that may change plans for those October convenings.
And I do believe that you all sent an email out for us to register for the 2 trauma healing project. Okay.
Yep, that's correct. And there was a flyer, I believe, in the packet. Yeah, so the page 15 of the packet has a flyer that has that RSV information, but it's Diana Aldridge is the person that you would RSV to.
So the new members that we just really, like today.
Yeah, we will want to make sure that the new members get that information for sure, so.
Any other questions around that? I see Kate, I'm reading, that Kate was saying the RSVP to Diana for the trauma healing trainings. Great. And with that, we will just do the wrap up. So if I got everything, hopefully you guys will tell me. Kate is going to bring back and send out to us some information about how we can advocate to the federal, on the federal government about some of the changes and the delays in funding, so how we can move that forward. And we are going to post the medical respite. We're going to make that presentation available to everyone so that people know who is providing those services, how they can access those services, and if they are thinking they would like to help, then they actually know the name of the providers who are providing those services and can reach out to them on ways on how to help. And then as far as the committees, James reviewed the new proposed committees and how to reach out if you would like to be a part of those new committees. And then after the strategic plan is approved in October with the Board of Commissioners, we will reach out to the HSC, the MAC, the Act Now, I'm missing something, the PHB, the 4, that was it. And you all can tell us if there's other places that we should be reaching out to where there are collaboratives that are working together. And we will try to reach out to them between October and the first of the year to have a plan and how we can all work together, share information, and move forward in January. And maybe even invite them to be on some of the new committees. So, all right. Did I miss anything in the wrap up? Nope. Go ahead, Commissioner.
Well, can I add just a member update?
Yeah.
Just a brief moment. Debbie Farr, for the past year, has been battling cancer of her upper urinary tract. Last Monday, a week ago Monday, she had her right kidney removed and ureter. And yesterday we went in for pathology reports, and she was declared yesterday cancer-free.
Oh,
Yeah, it's a miracle, with no need for follow-up chemotherapy. That's great. No, this is the last call we got in the day yesterday was our local oncologist, urologist, Dr. Wong, called at 9:30 last night, and he was laughing, screaming, said miracles do happen. And so Debbie will be back with us at these meetings. Great. And on another note, we just celebrated our 50th wedding anniversary 2 days ago.
wow. Congratulations. Okay, and with that, I want to thank everyone who joined us today. Congratulations to Debbie. Congratulations to our newest members who will be joining us, and meeting adjourned.